Hi everyone, I want to talk about how to prevent steroid complications. Steroid complications. Either you are prescribing it or you are taking it or someone around you is taking steroid. And to those who are abusing steroids, please be careful. Okay? Yeah. To start with, kindly go back, check my channel for the first video on steroid use. I asked the question there that are you using steroids either for treatment or for recreational purposes or for what performance enhancement or anything you are using it for. Go through that video, then you will know what you are running into as far as side effects are concerned. Now, I want to go over how to prevent the possible complications, the list of which you will find in my first video on steroids. Are you using steroid? Check my channel, you're going to find that. Okay, first thing to do is use lowest dose. Okay, if you are the one prescribing it, use the lowest dose for the shortest possible period of time. Then, to those who are using inhalers or powders containing inhaled corticosteroids, rinse the mouth with water after you inhale. Okay, to prevent osteoporosis in women that are on hormone replacement therapy or using oral contraceptives combined for a long period of time, then you use bisphosphonates, use calcium and vitamin D. Also, increase exercise. To prevent possible gastrointestinal bleeding, you can use proton pump inhibitors. You have lots to select from, though I've just written two examples here, Omeprazole and pantoprazole. To prevent hypothalamic pituitary adrenal axis failure, then you have to tail off the steroid, no sudden stoppage. No sudden stoppage. If not, there will be failure of hypothalamic pituitary adrenal axis and there will be crisis, possibly Addisonian crisis. So to prevent complication further, you have to check for the cataract in the eyes, the BP, to rule out hypertension, glucose, to rule out diabetes mellitus, and dexamethasone suppression test. With that, you'll be able to assess the function of adrenal gland when you're concerned about hypothalamic pituitary adrenal axis failure. And growth failure in children should be monitored with growth chart and rule out pregnancy in every woman of childbearing age. When you are suspecting or you are concerned about immunosuppression, immune boosting foods should be encouraged. And finally, I'm going to conclude where I started from, that you check my first video on are you using steroids? In other words, the effects of steroids. Kindly subscribe to my channel and you'll be able to get these productions or presentations immediately they are published. Thank you.